To conclude our documentation, let's look at the options to review your case and sign off. The Anesthesia module contains a particular functionality for tracking personnel times. You first saw this during your case initialization when the record prompted you to begin your provider time upon initiating the record. To access this documentation, you have the same options of using the toolbar or the toolbox. Let's review using the toolbar button. Click on Personnel. The window defaults open and shows the current documentation of personnel on the record. From this screen you can modify the dates and times and activity type of already documented personnel by double-clicking on the information on the corresponding line and column with the clinician's name. For activity type, you should pay close attention to who has been selected as the supervisor or the provider. In one chart, the supervisor is not the direct caregiver, but the provider. In a typical example, a CRNA will document themselves as a provider, while the anesthesiologist is the supervisor. This information is important for correct reporting of time and billing within the anesthesia practice. At the bottom right, you have the option to add additional providers or remove incorrect providers. Let's choose Add. The Select Personnel box appears, and you will find the providers available in the system are selectable boxes under the tabs indicating their position. These are anesthesiologist, anesthesia resident, CRNA, and SRNA. By choosing Other at the bottom, you have the option of choosing any person in the system catalog if their name does not appear in the list. For today's selection, let's navigate to the Anesthesia Resident tab and choose VC Test Anesthesia Resident. This selection will bring you back to the Modify Personnel screen and default today's date and time in the field. Modify the activity type to Resident and choose OK. At this point, let's assume we are ready to end the case. To do this, let's start by reviewing a few specific action sequences that are populated in your macro. In the to-do list, we will start by documenting the agent used during the case. Your macro will have all the agents available at your facility listed. Choose the agent used during the case, or the one used for the majority of the case, and document this as one inhalation. This is done for the purpose of collecting pharmacy data for usage and charging. After documenting the one inhalation on the agent used, remove the other two agents from your macro. The next action is Transport. Select this action and then Edit. From here, we will be able to document the details of how the patient will be transported. Many providers choose to document up to this point in the record and leave the screen open to transport the patient to PACU. Once in PACU and the final handoff has been completed, the provider returns to the open record and documents the details of the vitals documented in PACU. Alternatively, the process is to suspend the anesthesia case at this point and open the anesthesia record upon arrival in PACU to complete the vitals and next steps to complete your record. The last action on the macro is the anesthesia stop time. This should reflect the point of handoff in the PACU. After completing all these actions, the recommended practice is to stop your IV drips that are still running. The system will not allow a record to finalize if the fluids continue to infuse. If the supervisor has signed the record at any time, you can now finalize the case. If there are no supervisor signatures on record, then you would choose to suspend the case. To accomplish any of these actions, you go to the Task drop-down menu and choose Suspend here or Finalize here. Let's proceed to the Finalize process. Before the Finalize screen displays, you will be prompted to stop your provider time and monitor data flowing into the record. You do this simply by checking your times and hitting OK. The Finalize screen is divided into 4 sections and should be addressed top to bottom. By completing each section of the screen and addressing any alerts, it will improve the system performance and decrease system errors you may encounter. The first section is Deficiencies. This section shows documentation that the system has identified as needing further review or documentation to correct, such as a medication administration with a 0 dose amount. To address these, click on the icon in the Edit column to access the documentation. The second section is Required Documentation that must be completed prior to finalizing a case. This documentation requires closing out the Finalize screen to initiate that documentation and then restarting the Finalize process. The third section displays anything remaining on the to-do list. If you've already reviewed your to-do list and know that everything left is not applicable, you have the option to click Ignore All, which removes the rest for you. The final process that must be done is to choose Sign. This allows any providers to sign the record. After the required signature is on the record, the Finalize button becomes available. When you click on this, the case will close and the documentation is complete.